Does Tadalafil interact with amlodipine? It's a question that comes up more often than you might think, and if you've been prescribed both, it's absolutely worth understanding. Many people managing conditions like high blood pressure or angina are also prescribed treatments for erectile dysfunction or an enlarged prostate. So it's not unusual for Tadalafil and amlodipine to appear on the same prescription. But how do these two medications affect each other, and what should you be aware of? Let's start with what each one does. Tadalafil is a PDE5 inhibitor, commonly prescribed for erectile dysfunction and benign prostatic hyperplasia, which is an enlarged prostate. It works by relaxing the smooth muscle in blood vessel walls, increasing blood flow. It's known for its particularly long duration of action, up to 36 hours, which sets it apart from similar medications. Amlodipine is a calcium channel blocker, widely used to treat high blood pressure and angina. It works by blocking calcium from entering blood vessel walls, causing those vessels to relax and widen. This lowers the resistance in your arteries and brings your blood pressure down. According to NICE guidelines, it's considered a first-line treatment for hypertension in many patients. So here's where the interaction comes in. Both medications cause vasodilation, the widening of blood vessels, but through completely different mechanisms. When you take them together, those effects can add up. For most people, this additional drop in blood pressure is relatively small. However, in some individuals, particularly those who are more susceptible or when starting a new medication or changing doses, it can be more noticeable. There's also a secondary consideration. Amlodipine weakly inhibits an enzyme called CYP3A4, which is involved in how the body breaks down Tadalafil. This means amlodipine could potentially affect how Tadalafil is processed, though this effect is considered modest. The main concern with this combination is symptomatic hypotension. That's when blood pressure drops low enough to cause noticeable symptoms. These can include dizziness, lightheadedness, fainting, or unusual fatigue. It's worth knowing what to look out for, especially when you first start taking both medications together or if anything in your treatment changes. Importantly, this combination is not contraindicated, meaning it's not automatically off limits. Many people take both medications safely, but it does require careful monitoring and in some cases dose adjustment. That's something only your doctor should decide. Please don't adjust your doses on your own. One thing that is an absolute contraindication, meaning it must never be combined with Tadalafil, is nitrate medications. If you take nitrates for chest pain, this is critical information to share with your prescriber. Tadalafil also requires caution if you're taking alpha blockers. Always make sure every healthcare professional involved in your care has a full picture of everything you're taking, including any over-the-counter medicines and supplements. So what's worth discussing with your doctor? If you're taking amlodipine and you've been prescribed Tadalafil or vice versa, let your doctor or pharmacist know about both. Ask about whether any monitoring would be appropriate for you. If you experience dizziness or feel faint, particularly after taking either medication, flag that promptly. If you experience sudden or severe dizziness, feel like you might faint, have chest pain, or notice a significant change in how you're feeling after taking either medication, contact a healthcare professional. These could be signs that your blood pressure has dropped too low and needs to be assessed. So to recap, Tadalafil and amlodipine can interact by adding to each other's blood pressure lowering effects. For most people, this additional effect is small, but some may be more affected, especially when first starting or if other medicines change. And this combination isn't automatically unsafe, but it does need proper medical oversight. And Tadalafil must never be taken with nitrate medications. That's an absolute rule. This video is for general information only and is not a substitute for advice from your GP, pharmacist, or specialist. Please speak to a qualified healthcare professional for guidance that's right for your individual situation. If you found this helpful, leave a comment below. We'd love to know what topics you'd like us to cover next. And if you haven't already, please give this video a like and subscribe to the Bolt Pharmacy channel for more medically reviewed health information.